Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 094. A man was brought into the admission room after overexposure to cold. He complains of sharp pain in the small of his back and elevated body temperature up to 38 degrees C. He took some aspirin. Blood test. Leukocytes 10.5-10-12, L, eosinophils 5%. Band neutrophils 8%, segmented neutrophils 51%. Lymphocytes 32%, monocytes 4%, erythrocyte sedimentation rate 28 mm per hour. Urinalysis. Protein 0.6 grams, L, leukocytes, cover the whole vision field. Large amount of mucus. What is the most likely diagnosis? A. Acute glomerulonephritis. B. Chronic pyelonephritis. C. Subacute malignant glomerulonephritis. D. Tubulointerstitial nephritis. E. Acute pyelonephritis. Acute pyelonephritis is a bacterial infection causing inflammation of the kidneys, common diseases of the kidney. It occurs as a complication of an ascending urinary tract infection, UTI, which spreads from the bladder to the kidneys and their collecting systems. The most common symptoms are fever and flank pain. Other symptoms usually include nausea, vomiting, burning on urination, and overactive bladder, causing a frequent and sudden urge to urinate. For a urine sample, normal values are 0 to 14 mg per deciliter, and the normal value is less than 80 mg per 24 hours. If there is than 150 mg of protein in the urine per 24 hours, it is proteinuria. Proteinuria is a high level of protein in the urine that can be a sign of kidney damage. If there is 3–3.5 grams of protein in the urine per 24 hours, the patient has nephrotic syndrome. The normal range of erythrocyte sedimentation rate for men is 0 to 22 mm per hour. The normal number of leukocytes in the blood is 4.5 to 11.0109, L. The normal number of leukocytes in the urine is 2 to 5 HPF or less. Excessive numbers of leukocytes are most often due to the response of normal bone marrow to infection or inflammation. In some instances, leukocytosis is a sign of primary bone marrow disease, e.g. leukemias, myeloproliferative disorders. The answer is E. Acute pyelonephritis.